One thing I wanted to let you know about is with cataract surgery, there is very commonly a thing that can happen where there is a membrane that supports your implant and it can become cloudy over time. I had a patient today being evaluated for that, and they said, well, tell me about this membrane. Where did the membrane come from? How did it get there? Well, the membrane is actually the covering of the cataract. So if you're like me, you like the analogy of an M&M, you can think of the membrane as the candy coating on the M&M. And when we do cataract surgery, we make a hole in the front of that, suck all the chocolate out, or the cataract, leave that candy coating, the membrane, in place, and it's actually where your implant is supported and where it sits in the eye. In the same place as where your natural lens sat. Over time, though, there are some cells that live on that membrane, and they can start to grow across the membrane. They like to grow on things. And if they do, they can start to scatter the light and cause you to have blurry vision, just like your cataract did. Some people will feel like their cataract came back again. So this is a natural kind of thing that can happen after cataract surgery, the cloudiness of that membrane. It isn't something that went wrong with your surgery. It's not really a scar. It's not a complication from surgery. It's just something that can naturally happen because of the anatomy of that part of the eye, where there is a membrane there and there are cells and they can start growing again. It's a pretty common thing in younger patients just because they have more of those healthy cells. So it can be a little concerning, like I said, to patients, but it's not anything negative. It's not anything like a scar or a complication. The good news is it's very, very easy to treat that. What we do is sit the patient down in front of a laser that looks very much like the machine, the little microscope we examine your eye with. It takes less than a minute to do the treatment. It's completely painless. It will never get cloudy again because those cells don't have any place then to grow across, because what it'll do is cut a little opening in the center part of that membrane, allow that to fall into the back of the eye where your body reabsorbs it. There are no special drops you need after that YAG laser procedure, and there isn't any special restriction. So yes, it's a pretty common thing that can happen after cataract surgery. It can seem a little frightening because your vision is starting to get blurry or you're noticing glare, but it's easily treated and it's a completely permanent treatment. So no worries that way.